Before dressing any wound, it is important to assess a number of elements regarding the wound and the patient. These include, is the wound healing? Is the wound shallow or deep? Is the wound draining? What is the condition of the peri-wound skin? Is the wound bed clean or dirty? What other factors affect wound healing? Is there necrotic tissue in the wound bed? What type and how many microorganisms are in the wound? Once you have addressed and answered these questions, you will be better equipped to select the appropriate dressing for the wound. Is the wound healing? Look at the wound to assess overall conditions and compare the wound documentation with previous measurements. If the wound is not improving, consider other factors that affect wound healing. Is the wound shallow or deep? The depth of a wound helps determine whether the wound needs packing or just a flat dressing. Literature defines deep as 1.5 centimeters, but use common sense and look at the entire size of the wound. Is the wound draining? The amount of drainage will help determine which dressing category is appropriate for the wound. For example, a heavily draining wound could require an alginate, but as the wound heals and its drainage decreases, the wound could then require a hydrogel. Research has shown that an ideal healing environment is one that is optimally moist, neither too wet nor too dry. As a result, at one stage, a wound may require a product to donate moisture, and at other times require a product that will absorb or manage the exudate or drainage. What is the condition of the peri-wound skin? The condition of the peri-wound skin helps determine which secondary dressing should be used. Sometimes an adhesive is appropriate, and other times an adhesive is not only inappropriate but could cause damage to the peri-wound skin. As a general rule of thumb, if the peri-wound skin is compromised, adhesives should be avoided, and if the peri-wound skin is not compromised, then an adhesive may be acceptable. Is the wound bed clean or dirty? This is a fairly simple question. Look at the wound bed. If there is necrotic tissue, either eschar or slough, it must be debrided for the wound to heal. If the wound bed is clean, meaning red or pink, healthy and granulating or epithelializing, a good standard wound cleanser would be appropriate. What other factors affect wound healing? There are several factors that affect wound healing. They need to be addressed, especially if the wound is not healing. Some factors to consider are overall health status. Look at the medical and surgical diagnoses. Factors like diabetes, circulatory diseases, immunocompromised status, and histories of previous wounds all affect wound healing. Nutrition. Look at overall intake. Consider supplements such as protein and wound-specific amino acids such as L-arginine. Get lab values. Look at the level of albumin or prealbumin. Pay close attention to weight loss. Do not rely on the patient's memory. Age. As a person ages, the healing process slows. Consider this when assessing the wound. Body build. Obese patients are at higher risk for wound dehiscence and hernias because the adipose tissue is not well vascularized. The thin patient may also be at risk for wound complications. Oxygenation. The wound needs oxygen to heal. If the patient is not receiving enough oxygen, consider supplemental oxygen via face mask or nasal cannula. Mechanical stress. These are factors such as pressure, friction, and shear that will contribute to poor wound healing and must be addressed. Chemical stress. Chemicals such as povidone iodine, hydrogen peroxide, Dakin's solution, alcohols, and acetic acid can be harmful to the wound. The general rule of thumb is don't put anything in a wound that you wouldn't put in your eye. Many of these products will kill some bacteria. However, ask yourself, does the benefit of this outweigh the harm? Temperature. The wound temperature should remain constant. It can take up to 4 hours for the wound temperature to return to homeostasis after a dressing has been changed. Medications. There are several medications that could affect the way wounds heal. Anti-inflammatory drugs could delay the inflammatory process of normal wound healing. Antibiotics could mask other infections. Is there necrotic tissue in the wound bed? If there is slough or eschar in the wound bed, it must be removed for the wound to heal. There are several methods of debridement, including autolytic, mechanical, surgical, or enzymatic. What type and how many microorganisms are in the wound? This can be a difficult question. It is generally accepted that all chronic wounds are colonized with bacteria. The question is, does it interfere with wound healing? This is generally thought to occur when the amount of bacteria reaches a level of 100,000 organisms per gram of tissue. When this occurs, measures need to be taken to address the bacterial count in the wound bed. Antimicrobial cleansers and dressings are appropriate.